When I was a young boy, I came down with malaria. So when I reached the hospital, I had to wait for over like 6 hours to see a doctor. And just before I went into to see the doctor, after like waiting for 6 hours, the doctor went out for lunch. So from then, I said I have to become a doctor.
Where we practice in Uganda, it's a rural setting where there are no scans, there are no blood tests. I have to rely on my eyes, my ears, my sense of touch to diagnose a patient and care for them.
When I am in Uganda or I am in underserved community, I remember why I chose medicine, why I want to be a doctor, because I have been licensed to serve. And more importantly, the empathy is the essence of being a doctor.
We have an incredible cultural diversity going from Russia to Africa to Latin America and Vietnam, as well as different styles of hospital, different styles of approach to care that really broadens the opportunities for our students.
One of the wonderful things that this program does is that it brings over scholars from the countries with whom we work. These people bring to us their experiences, they learn from us, they teach us, and give us an opportunity to teach them as well.
A whole element of medical education in general is, dealing with situations that are very uncomfortable for you, and finding a way to deal with those situations in a foreign country only lends itself to better education.
When you get out of your ideal environment, you learn first to appreciate that you have enough, and then you learn to utilize it more and appropriately. And it also helps you to look at the other people in a different way.
It really provides an unparalleled opportunity for medical trainees, for students, residents, and faculty to really enormously enrich their outlook, to really broaden their perspective. And this is the experience that you can get only through those type of programs.
It is about patient care in that I think this investment ultimately flows back to this community by virtue of allowing us to take better care of our patients. It deepens empathy, it reminds people of the passion that called them to this profession in the first place.
The Western Connecticut Health Network is very fortunate to have Dr. Sadiq. He's a national leader, an international leader in global health with a vast experience.
Dr. Sadiq is really the master of this, the visionary, the person who's been involved in this sort of work for his entire career. He's amazing. He is just one of the most extraordinary people I've ever met. He is really the vision, the person who is at the core of this program.
Dr. Sadiq is a great humanitarian. He's a brilliant physician, a very capable diagnostician, a terrific communicator, and deeply sincere and widely respected.
He's a lifetime mentor for me.
Dr. Sadiq is a remarkable man.
Back home we call him the Encyclopedia of Medicine.
I wish if I could really send every single medical student, every single resident, and every single faculty to one of these resource-limited countries for a short period of time. That would be a great accomplishment. But obviously, we have a lot of limitations.
Let's be clear, global health is expensive. It's expensive to travel. We need our students to have good accommodations and to be safe.
It is the right thing to do. It is about caring for people. And this is, I think, a very clear expression of our desire to build capacity, not only here in the greater Western Connecticut community, but around the world.
We cannot exist without philanthropy, and the generosity and kindness of people like the Treves family is what makes this possible.
I've known Chris and Ava Treves for many years now, and it's special people like them that makes us better.
I'd like to especially thank Chris Treves and the Treves family for their foresight in supporting our global health program.
Thank you.
I would like to thank Mr. and Mrs. Treves and family and all of the other donors for their willingness to support global health program at Western Connecticut Health Network and University of Vermont. Thank you really very much.